Hopefully, if you're listening to this, you don't have polio, or smallpox, or tetanus, or hepatitis A, B, or C, or meningitis. Maybe you could even say that you are an overall healthy individual. Most of these viruses have the potential to kill you in a short period of time. According to the Children's Hospital of Philadelphia, over 3 million children die from VPDs or vaccine-preventable diseases each year. To put things into perspective, this is the entire population of Iowa. All of these viral particles are floating around you right now, and you've most likely inhaled them. Yet, our immunity already has the defense it needs to prevent anything from even starting. This is why we vaccinate. If we can travel back a few hundred years, as far back as the 1790s, we can note one of the biggest discoveries in healthcare to date. According to the CDC, VPD is listed as one of the biggest discoveries in healthcare to date. Thanks to Edward Jenner, who at the time was only a rural town doctor, was able to create the smallpox vaccine and initiate a domino effect for prevention of diseases. This is something that the world had never seen before. We have in fact seen our fair share of diseases. Most of us have never hopefully come across them, and if we have, we can say we survived. Let's take the flu for example. This virus has been a consistent predator that takes over 500,000 lives each year. An article by the CDC that dictates the 1918 flu pandemic as one of the deadliest to date. But thanks to the vaccines, we have been able to prevent a lot more. A big misconception is that the flu shot gives you the flu, and this is in fact a myth. Here I have a visual aid that estimates the number of illnesses, medical visits, and hospitalizations prevented during the 2015 to 2016 flu season. So the estimated number of illnesses prevented by the flu vaccine was about 5 million people. The estimated number of flu medical visits prevented by the vaccination was 2.5 million. And the estimated number of hospitalizations prevented by the vaccine is 71,000 people. The flu virus is just one of the common viruses that can mutate very quickly. This can lead to many pandemics, just like the 1918 one, and this is why the CDC suggests vaccinations. According to the Mayo Clinic article, Flu Shot, Your Best Bet for Avoiding Influenza, the vaccine on average is 60% effective. Depending on the season, it can be 90% effective. Not only do we vaccinate for ourselves, for the immunity of children and the elderly. According to the article, the impact of influenza vaccination on the adverse effects and hospitalization rate in the elderly had a 28% decrease in hospitalization when we were surrounded by people who were vaccinated along with themselves being vaccinated. I'm sure many of us know or maybe even are skeptics of the vaccine. All vaccines we receive are studied, produced, and given safely and effectively. Our immunity of the general population would increase tremendously if more people could take the needle. It is imperative that most individuals, if possible, could receive the vaccination. Without the shots, half of the population could easily dissipate without it. Our vaccines have proven its worth, and not getting them could result in the unnecessarily killing of literally millions of people, especially since Mayo Clinic, the World Health Organization, and the CDC have given us these numbers. Sure, we listen to the CDC about romaine lettuce, but not about vaccines.